a bill before the parliament, whether it's a policy on many of these issues. I've read some policies, and I must be fair, I've read some policies whereby policymakers are proposing to give money to young girls to discourage them from having sex. And I ask myself, what is the basis for this policy? What evidence are they using to make that decision? But as you know, that decision is probably not influenced by evidence. It's probably influenced by a certain religious beliefs on sexuality of young people or what's considered appropriate. And I'm sure even in your own line of work, you must have seen certain policy decisions that you wonder what sort of evidence so again, our role as scientists or as researchers is not only to generate evidence, but also to see that our evidence informed decisions that are being made on the issues that are of paramount interest to us. So I've put together here a definition of evidence based decision making, and this definition is not mine, but I think it's the definition that really captures the essence of evidence informed decision making. So it speaks about a systematic and transparent approach that applies structured and reliable methods to identify, evaluate, and make use of evidence across decision-making processes, including for implementation. And we're going to look at all the decision-making processes as we go along. Please go to the next slide. But why is it important to really use evidence in making a decision? Why is it really important? Note that the emphasis is on structured and replicable methods. So we are talking about highest available, quality of evidence that you can imagine being used to inform decision making. So that's the essence of structured and replicable methods or sort of approach. But not only, but it's also important to use evidence to identify the problem and then to inform what constitutes solutions to the problem. Please move to the next slide. And even when we implement intervention, it's also important that we generate evidence to get feedback about what is working and what's not working. And mostly, it's important that when when we develop a policy, say in mental health, for instance, it's important to assess whether that policy achieved the desired goal. Why did we formulated a policy to address a problem? Is the policy working or not? Are we implementing programs? Are the programs are implementing working or not? So I said the emphasis is on decisions are informed by the best available evidence because there are different kinds of evidence, and we're going to talk about the various forms of evidence that are there. It's important that the evidence is relevant, that we're using the relevant and applicable evidence, what is informing our policies and programs in mental health. It's also important that evidence is assessed in a systematic and transparent manner, unaffected by conflict of interest. Now, it reminds me of one thing. There is a Christian association, Christian Professional Association, that conducted a study. They conducted a survey to on 3 controversial issues: on sexual agenda minorities, on abortion, and on, I think, assisted reproductive technology. And they came to the conclusion that, almost near 98% of the population are against all these issues. Now, if you look at their methodology and if you look at the study, you can tell that those studies were not rigorously designed, both in terms of the way and the manner and the approach in which they ask the question, but also in the sample size, the sampling, the strategy. But their goal is to use that evidence to, inform the position of the country on those issues, even though the studies are not of top quality. What am I saying in essence is that people that are opposed to a particular policy position know the importance of evidence, and they are going to, put together their own form of evidence to inform decision making. And that really emphasizes our role as scientists to be able to, critique the evidence that are being used to inform decision making, to ensure that the evidence are not only relevant, but they are transparent and they are the best available form of evidence that are informing decision making. Please go to the next slide. Now, if you have comments, if you have contribution, if you have examples that you want to share, you can use the reaction button to raise your hand so that you can chime in, or you can also note your contribution in the chat box. Now, I was saying, why is it really important to use evidence in decision making? Why is it important? One, it's important to use evidence to improve the effectiveness and efficiency, as well as equity of policies and intervention. It's also important to improve transparency and accountability. It's also important to use evidence to make decisions to facilitate a more efficient use of scarce resources. As you know, we don't have unlimited resources. And when you use evidence and you're making the best decision based on best available evidence, you are also contributing to reducing waste of resources. Now, the idea of also addressing ensuring equity is also important, because often some people are more impacted than the other, and it's important that policy centers the experience of marginalized groups. When we speak about mental health, we do know that mental health affects marginalized communities than everyone. Even take for instance, if you focus on youth mental health, those that face childhood adversity, they tend to suffer, more mental, disorders or distress or symptoms than those that do not. Those that are pregnant as a child are more likely to, report mental distress relative to those that do not. Those that live in certain marginalized communities, maybe in informal settlements, tend to report more mental distress than the other. This evidence is really important. And if evidence is informing decision, if we're developing programs to address some of these issues, we would then use that evidence to center attention, to concentrate intervention where the need is the greatest. So it's important, and it then helps us to achieve maximum impact, as opposed to, basing the decision to implement intervention based on politics or based on religious consideration or based on other consideration. When we use evidence, we're able to prioritize resources where it's most needed, and we're able to have best value for the resources we're spending. Next slide. Now, if you can think of additional importance of, basing decisions on the best available evidence, please note it in the chat box, or please indicate through the reaction button so that we allow you chime in to speak. Next slide, please. Immaculate, please go to the next slide. Okay. So now, here is why I put this slide here because I think it's important that when we talk about evidence, we also understand the sort of evidence that informs decision making. Now, broadly, there are two forms of knowledge. One is tacit tacit or colloquial knowledge or evidence, or scientific or research evidence. All of these play a role in decision making, especially when we speak about, say, national level or county level, district level, state level, policy on mental health. All these forms of knowledge play important role. But for us, I know that our interest, rests entirely on scientific form of evidence. But it's also important that we are aware of other forms of evidence that might impact decision making. Now, when we speak about tacit evidence, we speak mostly about informal and often include opinions. This could be the opinion of bishops, for example. You see, when we want to set that mental health policy, all stakeholders will be involved. There's going to be public hearing, there's going to be public consultation. So meaning all interest groups are going to have their say. They are going to submit their opinion, whether in person, verbally, there are public hearings, or maybe in writing. And they are going to advocate for what they believe should be the right approach to address a particular issue. So often, we also depend we depend on this opinion. And I mean, this sort of knowledge is actually how we get by our day-to-day, life. Pastors will tell you, do not do this, do not do that. Your parents will tell you, do not do this, do not do that. And, I mean, probably the evidence might emerge or might emerge based on their experience. And they might be advising you based on their own lived experience. And it's a relevant form of evidence, although it's not the highest standard of evidence available. And it might just also be because of revelation. You see, there's a lot of prophecies, and pastors will always want to also show their importance when it comes to decision making. So more often than not, the decision, the more controversial the decision, the more you see religious leaders advocate for a particular position, and they come with knowledge, maybe from a theological point of view or from the Bible, to adhere to a particular policy debate or discussion. So, however, as far as I'm concerned as a scientist, I do not believe that that should be the best available form of evidence. Take, for example, should suicide be decriminalized? Because in most of our country, if suicide is criminalized, so if someone attempted suicide, the state can actually charge the person. But is that the best approach to tackle suicide? From a scientific point of view, you might argue that that's not the best approach. But religious leaders would have an opinion on why there should be a punitive penalty for anyone that attempted suicide, because life is precious. And according to the Bible, no one is allowed to take another person's life. You can't even take your own life according to the Bible. Hence, that form of evidence might have a lot of resonance with decision maker, and that might be the reasons why we have on our books punitive law against suicide attempts. That said, it is our role, as I keep saying, for us to make our best available evidence available to policymakers and help them understand how best to make decisions on some of these issues. And mind you, some of these policymakers are also scientists. They are well educated, they have got a degree, and if you approach them, you might even be able to gain more traction because they will understand your language better. But sometimes also political experience, they may not also, go with the right decisions, and you see those things happen all the time. Now, scientific knowledge, I don't need to tell everyone here about what constitutes scientific knowledge, because that's our own bread and butter. So you can move to the next slide. But it simply means knowledge that are rigorously, collected through systematic approach. This is not a value judgment sort of evidence. You rigorously collect data, following a particular methodological approach to arrive at a conclusion. So that's the kind of knowledge I would call scientific knowledge. However, even scientific knowledge have hierarchy. Please go to the next slide. So, and I think it's important that we also go through the hierarchy of evidence. At the lower ebb of hierarchy of, please move to the next slide. At the lower ebb of the hierarchy of evidence is where we have expert opinion. So more often than not, when decisions are being made, they call on experts on the issue to come and, share their thoughts around the topic. And they will come and share their opinion. But then again, that's the lowest level of evidence that is being used to make decisions. There is also qualitative studies. Qualitative studies are subjective forms of evidence. So please move to the next slide. So qualitative studies are subjective form of evidence that play an important role in documenting stories, helping us to understand patterns. Please click a few more times so that you can have all the things there. Yeah. Okay. So we have qualitative studies as well as case report studies. They are also really important in the role they play in the evidence ecosystem because they document stories. It gives us examples of who is impacted, how mental health probably impacting the community. You can understand the manifestation of the of mental health symptoms, the impact on the family, in forms of stories. Now, it may not use large number of people, but just a few stories to help people, put a human face to the problem that is being discussed. Good qualitative studies can help us understand different dimensions and patterns of presentations of depression, for example, how it impacted the person's ability to work, how it impacted the person's ability to fulfill their role within the patriarchal system. And this form of evidence can really, really be appealing to policymakers. So they are really important, even when you're pushing for a particular policy. We also have cross-sectional studies, observational studies, that can provide a snapshot of the problem. So it plays an important role as well in helping understand the burden of the mental in a community. But as you see, the higher we go, the more rigorous the evidence. And this hierarchy connotes, more quality evidence as it goes on. So we have case control studies, we have cohort studies, randomized control trials, systematic review, and mental analysis. And systematic review and mental analysis are the highest level of evidence because they pull together all studies to be able to truly estimate the effect. And that's why they're considered to be the highest level of evidence. However, because systematic review or meta-analysis at the highest level does not mean you always need that form of evidence to make decisions. That's not the point. All forms of scientific evidence can play an important role in decision making. And it depends on the kind of decision that is being made. If you are basically trying to understand the burden of a disease or the burden of depression, who is more affected, you probably don't need a meta-analysis or a randomized control trial to do that. A simple cross-sectional study might be enough and to do that. If you're also pushing for a better understanding of the problem, qualitative studies might be important to enable people to better understand the problem that's being studied. So for me, really, it's not just to say that this evidence is more useful than this one. That's not the point. But just for us to understand that there are hierarchy of evidence and that we're able to point policymakers to the most relevant evidence depending on the decision that is being made, that is about to be made. If the decision to be made is what programs are promising to address and tackle a particular problem, you might look at randomized control trial studies or mental analysis or systematic review of those studies to be able to decide what intervention should be, included in a policy as a solution to a problem. Say for example, if we are trying to improve the mental well-being of adolescents that are living with HIV, for instance, what are some of the interventions that are promising that have been implemented that we can push for in a policy? So if that question is the decision we want to make, we'll then look towards systematic review and randomized control trial. And we're going to look at that decision, evidence-informed decision ecosystem to really look at all the decision points and the kind of evidence that are relevant in that sense. Please go to the next slide. I think I have a question to pose or some key summary in the next slide. Please go. Yeah. So maybe just to summarize, I know I've spoken a lot. Maybe just to summarize, I think it's important to know that there's hierarchy of scientific evidence. That even though there is hierarchy of scientific evidence, it doesn't mean that the evidence that are the lower L are unimportant. They are really important. Expert opinion is really important, and in maybe not so much in the way we, but I think so. No, I think so. They do that. It's just that many of us scientists don't partake in decision making. We don't go to the parliament to argue positions. But civil society organizations often do that. They often go to be part of this policy making process. This process of passing bill into law. Experts are often called in parliamentary committees to come and share their thinking about a bill. And that's an opportunity we need to take as scientists. We need to identify, we need to go to the daily gazette from the Senate, from the parliament, to see the timetable, to see what bills are being proposed. And then to be able to share our opinion, whether in person or whether through just submitting an amicus brief, or just noting our observations about some of the provisions in a bill. I think we should do more of that. So expert opinion is important, qualitative studies are important. However, when we are pushing for a particular intervention, I think it's extremely important that we are using the right form of evidence to inform where countries will be budgeting their money when it comes to the mental health. So when there's an opportunity to define an intervention, let it be informed by rigorously tested intervention that we then put a lot of money into. I think it's also important that we evaluate what constitutes good evidence, depending on the decision in question, and scientists don't always get it right. So I think that's also very important, that even though we say this is scientific knowledge, some of us don't do excellent work. We do our best as scientists, but we are not infallible, and it's important that even policymakers also understand that we are not infallible. We are not infallible. We don't get it right all the time, and it's important that we critically evaluate evidence before informed decision. Please move to the next slide. So I think we can pause here and allow for contribution. I think we can pause a little bit to take some comments on what you think. I'll pose a question. How are decisions being made in your country, and what sort of evidence do you believe is informing decision making in your country? So that's my question to you. I think it's an opportunity for us now to discuss. So you can unmute and speak on what evidence is informing decision in your country.
Sorry, can you repeat the question?
My question is, I want you to share your experience regarding the evidence from where you stand. What evidence do you think is informing decisions, laws that are being passed, policies that are being implemented in your country, from where you sit? I just want to hear from you. What evidence do you think is playing a prominent role in your in decision making in your country? Also, if you've been part of any policy process or maybe policy review, policy formulation, or you've advocated for a particular policy or bill and you want to share your experience with us, I think this is the time to pause and for everyone to weigh in and to share experience. So please unmute to share your experience with us.
Okay, I'll try to answer that. Personally, I think it depends with the context. For example, I'm a Tanzanian, and in my country, there are scenarios where they would prefer the lower levels of the hierarchy of scientific evidence, but there are some situations where they would consider the higher levels of the hierarchy. For example, when it comes to making informed decisions in healthcare and similar fields, normally the higher levels of decision making, the higher levels of the hierarchy are more considered and are more favored more than the lower levels, the expert opinions and whatever. And I think maybe this could be more adopted in other areas. I support more of those higher levels decision making. This is because they have this the statistical power, the meta analysis that we're talking about. We could combine the data from multiple studies and increasing the statistical power to detect the effects. So yeah, it goes down to situationship, but I would prefer to use the higher levels because they are more scientific and they have that statistical power. Thank you.
Thank you very much. We can hear from two more people before we proceed. What evidence what is the role of evidence in decision making in your country? Yeah, please unmute, speak. Wait until you are called upon. Just unmute and speak if you have something to share. Okay, I think I'm just going to go ahead. So I spent here, where to find the best evidence? Where do we find the best evidence? And we can find evidence through citizen engagement. And we do this a lot. And as I said, we do public hearings. There are various ways of, and citizens generally, even though it's very contested, but generally have ability to contribute to the process of decision making. As you know, citizens have lived experiences, so they can tell policymakers how they are being impacted by a particular issue. So they are definitely able to do that. Just by the fact that citizens' engagement is often contested, we are promoting that regularly, even in our constitution. I do know that in the Constitution of Kenya, for example, public engagement is really, really crucial, and it's really, really mandated before a bill is passed or even a policy is enacted here in Kenya. And I hope that's the case as well in our respective countries, that citizens do play an important role, or citizens engagement play an important role in decision making. There is expert opinion, and as I said previously, considered as a form of evidence. So expert opinion is always important. I mean, if you turn on the radio shows, TV shows, when a bill is being debated, even televisions bring experts to the TV to come and inform the public. So expert opinion is also another form of evidence to look towards when we are debating a policy. There's also expert panel, the good old boys sitting around the table. Unless the panel members were asked to share their evidence as above, or were supposedly by a robust guideline the development process. So often there is also expert panel who can also present evidence or consider to be another form of evidence. There's also jurisdictional scan. Jurisdictional scan. But the risk of groupthink is there unless people in the jurisdiction being learned from share their supporting evidence or plans for generating it. All these ones in blue, even though they are forms of evidence, they are often well contested on whether the evidence they are sharing it's a special interest kind of evidence, or it's really a rigorous form of evidence. As you know, even the science of evidence production is political. Science is so contested on many issues. There's a lot of contestation on many issues. For many years, we do know that tobacco smoking consumption is bad. But up to today, we've not been able to do much about it. Of course, we've done a lot in terms of ensuring that they label their products, talk about the risk of their products and all that. But to win against the tobacco industry has become very, very difficult, irrespective of the harm that tobacco products pose to human health. Now, that's just to focus on one. That's just to focus on the role of the tobacco industry. That said, even let me use another example. So to also illustrate the point, for pharmaceutical companies over the years have also taken advantage of people to push products that are not rigorously tested on the population. And I don't know your experience with COVID vaccine, for example. A lot of people had the vaccine and they still got the virus. And people call into question whether the vaccine really worked or not. So, bad faith, good faith. Are they operating in good faith or bad faith? Are they motivated by money? So science is really, really politicized. And we need to, be firm as scientists to be able to do our work, to ensure that our work are not being influenced by special interests. Whether it's from the tobacco industry, the pharmaceutical industry, we need to be able to call it straight to ensure that the evidence we advocate for are rigorous and of top quality. And that's one of the reasons why expert opinions, expert panel, jurisdictional scan are often, those citizen engagement are often super contested. People want to know, where is your evidence? Where is your evidence? I think it's really important to always ask for the evidence that's informing a particular position. Now, there's also behavioral and implementation research, and this can play an important role in informing decision. Now, there's big data analysis, modeling,
as well as evaluation, and also all kinds of evidence that can inform mental health decisions. I see on the chat box, in my opinion, behavioral and implementation research is the best for decision making. I don't know whether you want to elaborate on that, Adam. Adam, are you able to elaborate? You can unmute and elaborate. Why do you think behavioral and implementation research is the best form of evidence to inform decision making? Or anyone, why is behavioral and implementation research the best form of evidence? Yeah, please unmute if you want to chime in. Why is behavioral and implementation research the best form of evidence? Okay, we can move to the next slide if there no one is answering that question. Now, I'd also put here various sources of data. As you know, and depending on the sort of evidence you're looking for, usually there's always the sensor that generates a large amount of data that you can call on, depending on the issue at hand. There are also national surveys like the DHS, which has also been analyzed into indicators through stat compilers, through IPOM. There's also DHIS that monitor routine facility data in a country. And there's also, the National Bureau of Statistics always collects large amounts of data on a regular basis that we can reanalyze as scientists to inform decision. But these are forms of data sources that can help us identify high priority issues to understand what the problems are. So if the goal is to understand, I know some DHS include issues around mental health, but not for all countries on the continent of Africa. But I think I've reviewed a paper that looked at mental health issues through DHS. I think maybe for Kenya, but I can't remember vividly. But not all countries do collect data on the burden of mental health. And I must say, if you are here from Kenya, APHRC recently completed a national survey on young people's, on adolescents' mental health. If you engage with the PI of that project, who is on the call as well, Dr. Frederick might also be able to make that data available for you for further analysis, provided you have research questions that you can justify to him. He's able to make it available for you. So that sort of national survey on young people's mental health is really important. We want more of those because those sort of data are also not available in most of our countries. But again, let me also hear from you. If you want to understand the burden of mental health in your country, where are the data sources? What data is sort of available to help you understand the burden of mental health in your country? Or there are no data in your country when it comes to burden of mental health? Where do you look towards to find data on the burden of mental health in your country?
Think, Anthony, I think you raised an important question. I think the easiest answer to most of the participants would be that until today, it's known that there hasn't been a lot of focus on mental health, right? So even regular surveys like DHIS, as you say, have not had indicators on mental health. National level surveys on mental health, whether it's for the general public or for younger people, for example, have been missing. And I think that's why you refer to, say, the Kenya National Adolescent Mental Health Survey, which for the first time was the first really national level study on mental health among younger people in Kenya. And as far as we know, for example, in Kenya, that's the only data sets that can come close to telling us the burden of mental health illnesses, among younger people in Kenya. But for other countries, I mean, and perhaps only South Africa could have various sources where you could get some sub-population level data on mental health, and yet it may not cover all important demographic groups within that population. So I think the short answer to majority of the people here are coming from Africa would be that there's very little in terms of reliable and up-to-date, evidence on the burden of mental health in their countries. What we have are subpopulation studies, small studies that may not be generalizable. Some are based on health facility data that is not generalizable to the general population. Over.
Thank you very much, Dr. Frederick, for that important contribution. And I agree with you on 100% that when it comes to mental health, we've not placed enough sufficient priority on mental health, and there are gaps in terms of data to understand the burden the burden of mental health, who is more impacted. All these things are very difficult questions to answer. And I remember our experience, Dr. Fred, when we were, reviewing, we were conducting review on young people's mental health in Sierra Leone and Senegal. I think we also note that as part of the important findings that there are no national studies to help us really understand the body and who is more impacted, because there are no national surveys, including mental health outcomes in those countries. And that's actually the situation in most of our countries on the continent. And it emphasizes our role as researchers to be able to do these studies, to be able to do these national studies and contribute this evidence, because with that, we are able to move the needle and make issues of mental health a national priority. Because how do you make issues of mental health a national priority if there are no data to actually tell us the burden, who is more impacted, how many people are impacted? If we can't answer those basic questions, then how do we convince politicians to put more priority and to put more budget on these issues, to provide more psychiatrics, to fund more mental health institutes, to beef up our response to issues of mental distress? It's going to be hard if we don't have this evidence. I think it's important that even on the minimum that we include mental health in our DHS. If we can push for that, that will really, really be important, because at least DHS is being conducted every 5 to 6 years. If we can have some indicators on mental health in that alone, that would be huge. And that's one of the things we should be pushing for, I believe. But if there are resources that we even do a mental health survey like we did here in Kenya, and be able to have that data now to make it a priority. I was in a technical working group meeting with the ministry, and they cited the national survey that was jointly implemented by the Ministry and African Population and Health Research Center. And with that, really, there's a lot of emphasis on the need to address mental health of young people in the policies they are developing. And they are using that data as the basis to justify that, because even decision makers need some evidence to justify why they are putting a lot of priority on an issue. Also, if we want to design solutions, what can be done and how large are the anticipated benefit and of an intervention we aim to implement? We might need to look at systematic reviews of interventions effectiveness. We might need to look at qualitative evidence synthesis. We might look at the Cochrane database for systematic reviews, as well as access for clinical interventions, for us to be able to advise our decision maker when they want to design solutions to a problem. Also, we might design implementation. If you want to design implementation, what are the barriers to implementation? What implementation strategies might be needed? We also might look towards systematic reviews of qualitative studies or process evaluations of interventions. Because now most of the researchers that evaluate interventions tend to also conduct process evaluation, and then they're able to document lessons. And talks about the barriers associated with implementing an intervention and strategies to mitigate those barriers. So that's about data source. Please go to the next slide. Now, if you have any contribution, I think now is also another break for us to really look at to discuss some of the things we've been discussing in terms of the availability of data in mental health, in terms of what evidence is informing policies in our country. If you still have any contribution, now is the time to take the opportunity to share your thoughts.
Yes, let me just add a bit of that from what Dr. Fred said. What he said is true. Getting mental health in our African countries is a headache. But I think one of the best sources to go to health facilities. Here in Tanzania, I with my team, we just did that. We went to the psychiatric mental health national hospitals, and we collected a lot of thousands, if I could say, of mental health data sets. Now, we can use that maybe to generalize the burden of the mental health situation, and that could be part of that. It could tell us a picture of how much of a burden and how the government should how serious should the government take and consider mental health. So getting into those hospitals, collecting the data, I think currently is the best way forward. Thank you.
Yeah, thank you very much. I mean, if you don't have resources, what I'm trying to recall your name now. It's Nyanda, right?
Yes.
Yeah, what Nyanda's proposes might be an alternative approach to understanding the burden of mental health. I think what hospital data would do, as you know, is only the worst cases that gets presented in a clinic. So it will tell you a bit about the severity of presentation, the number of patients they are seeing.
Is that me or we lost Anthony?
Reporting stroke. was. So those data sources are the points are also really important as far as I'm concerned in the role they can play, especially when there are no resources to do a national survey, because national surveys are really expensive and you won't be able to do that all the time. Let's take more contributions. Now, we've started talking about some of the challenges that we might face in our space in mental health, that we do not have data, national level data. And national level data are really, really important, because if you conduct a study in a school, for example, say in one university, that's not the kind of evidence that the policymakers are looking for. They need evidence that are nationally representative, that are generalizable. And that makes it really, really challenging. Yeah, if what's available is small scale studies. Not that they are not useful. I mean, small scale studies are also useful, but that's not the best quality evidence when it comes to understanding the burden of a problem. So often, or more often than not, they want nationally representative studies. But the barriers to use of evidence in decision making, or the gaps between evidence and policy translation, are really huge on the continent. We have fragmented policy landscape on the continent, and it takes people that have been in that space for quite a while, or that have maintained that long-term presence, to be able to understand the policy landscape in many of our countries, because it's really fragmented. A policy might have a 5-year term, but it doesn't mean that a new policy will be formulated or the policies will be reviewed after 5 years. Things are really, really fragmented, and sometimes they are also donor-driven when it comes to decision making in all these areas. Also, we researchers, we rarely interact with policymakers, or let me say vice versa. For much of us researchers, we do not have any relationship with decision maker on the issues we focus on. So as such, even when we generate very good evidence, policymakers may be unaware of the evidence. As such, they are unable to use it or use them. Also, many policymakers on our continent are not trained to conduct or use research or use evidence. They're not trained to conduct research. So, coupled with the fact that we also, the way we also present or communicate our evidence in technical languages, it makes it really difficult for them to use our evidence, because many of them are not trained to read scientific paper or literature. Also, they prefer to then listen to opinions, expert opinions, because those ones are readily accessible and easier to use than our jargons. Also researchers, we also rarely assess the evidence needs of policymakers before we design our study, and we rarely involve decision makers or policymakers in the research process. All these things present challenges to the use of evidence on the continent. Also, researchers have a limited understanding of the social political processes involved in policymaking. Rarely do we understand the intricacies of the politics that goes into adopting a particular policy position or not. Policy-making process it's also a political process in a way. And often decisions can really be contentious because people want to go different direction. And politics is about who is in power. And often you can't always divorce both the political processes from the policy-making processes. In fact, you've seen situations where a governor or a president will announce a policy position even on the campaign trail, and or even in giving a speech. I've read a number of studies that evaluated maternal health policies in many of our countries, and in some of our countries, those policy positions were just announced by the president without consultation, just one day to say, oh, there's free maternal health care. And that's the official position. So it's often the political process that for us, it makes it difficult for us researchers to be part of, to be able to advise in certain situations like that. Also, there are also always implementation gap. And this often occur due to resource constraints, competing priorities, or resistance to change. And this gap is always huge. Even when we formulate policies, we do very little. We don't do too well in terms of implementation of these policies in many of our respective countries. Now, I don't know whether this resonates with you, or whether you have a different opinion in terms of own assessment of the policy making process in your country. Do you think these challenges have presented there some sort of align with what you see in your countries in terms of challenges to use of evidence in decision making? Let's hear from you. What do you think? Do these challenges resonate with you? Yes, they do, from Antonia. Others, I want you to weigh in. Do these challenges resonate with you? Do you think these are some of the challenges that impact the use of evidence in decision making in your country? You can put in the chat box what you think the situation is in your respective countries. Okay, while I will do that, I might just I need to speed up now. I'd written here, what additional gaps did you observe in your contest? What additional gaps did you, observe in your contest when it comes to barriers to the use of evidence in decision making? What additional gaps did you observe in your contest? Okay, I am now going to pivot to another topic. I'm going to now talk about theories and strategies for getting evidence, research or evidence into policy and practice. I'd said here that for us researchers, and particularly for us on these workshop, I think it's important that we begin with policy uptake in mind when we design our research. Why is this important? When you have in mind that you want your research to impact policy-making processes, you do your research differently, in that you probably begin to map who are the policymakers that you need to engage, and you will then make considerable effort to engage them throughout the implementation of your study. I'd said also, it's also important to invest in relationship building. More often than not, if you do not invest in building relationships, your evidence might not be used. And as I said previously, decision will be made with or without evidence. So it's our role as scientists to invest in building relationship with decision maker so that we have their ears as they consider policy priorities on mental health. If we want more investment in mental health, if you want more attention and more focus on mental health, we need to have relationship with policymakers. Whether it's your parliamentarian, whether it's the technical staff in the ministries, whether it's the president as Labour's president, we need to have some sort of relationship with these decision makers so that we can advise them on the best policy course that they should take for the country. It's also important that we conduct needs assessments and that we co-create research priorities with decision makers to ensure that we are responding to the evidence priorities and not our own personal priorities. You know, when the evidence we are generating aligns with the priorities of decision makers, we'll see better use of evidence in decision making, as opposed to when both priorities do not align. We generate evidence for the sake of generating evidence, and they do not directly impact the needs of decision maker, and that represents a problem. So the more we conduct this assessment to understand what evidence priorities resonates with policymakers, the better that we're able to tailor our research to meet those needs and address those priorities. It's also important that we do mutual capacity strengthening. I said earlier that the process of policy making is fragmented. We've said that the process of policy making or decision making is not only fragmented, but also it's not only fragmented, but also complicated. This is like a political process that is a bit difficult to navigate. So many of us don't even know the timetable, the schedule, when is the next public hearing. Yeah, so it's important that we, are able, and then policymakers as well, I say, may not be able to read our articles, particularly when they are written in all those technical languages. So it's important that we meet ourselves somewhere, and capacity strengthening might be an approach to help us bridge that gap. One, to help us as scientists to understand the policy-making process and windows and calendars, and also for us to also help them understand all those what the effect size actually truly means. All those technical terms to help them understand how to read scientific paper. We can do that together, where we are both in a room where policymakers are training us on the policy-making process, the windows of opportunities, and then we are also training them on how to understand effect size, how to understand hierarchy of evidence, all these things we can do together. Another thing we can do is to communicate our findings to a variety of audience using accessible languages. And I think we do that well at the African Population and Health Research Center. We don't always complete our study, write a technical report and publish papers. We do well in types, we write blogs, we write for media in accessible languages. And we also, translate some of our findings to accessible languages, to local languages. We disseminate in the communities. All these are important to ensure that evidence are informing decision. Because one group that we've really neglected as scientists is the communities impacted by the issues themselves. How often do we finish our data collection, finish our report writing, and go back to the community to actually disseminate our findings to the community? As you know, changes do occur in the communities, and there are things that people within the communities can do themselves to address the problems around them. I know on child marriage, there are shifts that formulated bylaws to compel parents to not give their daughters in marriage in young age. I mean, all these changes can happen within the community. I've seen situations where when young people are out of schools, the chiefs together with the community leaders do go to those households and then prevail upon their parents to ensure that they put their kids back in school. So changes can happen at the community. So it's incumbent on us to take our evidence back to the community and to ensure that they understand the evidence we've generated and are able to take up actions to address some of these issues. But it's incumbent on us to communicate our findings to a variety of audiences. I'd also say that we should be an activist and we should advocate for science. We do a lot of work. We put a lot of work in generating evidence, and we have to be an activist to ensure that the evidence are also being used. Without that, use of evidence might not be taken seriously. Also, it's important that we and another reason why I say we should be activists and advocate for science is that there's also a lot of anti-science sentiments on social media. There's a lot of misinformation. And it's important that we address this misinformation, that we set the record straight when evidence is being misused, when evidence is being misinterpreted or misrepresented. We have a role as scientists to ensure that we set the record straight and that we address the misinformation, that we debunk the myths around science. Also, it's important that we establish a rapid response mechanism through which we can rapidly, synthesize evidence to inform decision-making. I'd said that, there are always windows of opportunities to contribute our evidence, and we should be able to create that mechanism where we can link our universities, our centers of excellence for research with for greater good and use of decision maker, through which we can synthesize evidence on a rolling basis to inform policy positions. We've done this through our project at the African Population and Health Research Center, and this has really worked well, where the abuse before the parliament were able to synthesize evidence. Whether I say in Kenya, in Botswana, in Zimbabwe, even in Namibia, we've done that. Now, I like this Davis Phillips co-produced Pathway to Impact framework. That's also another way to think about moving evidence into policies as well as impact. Often we conduct research and the research helps produce new knowledge. But then it's also important, as I said previously, to form partnership, even through the research process. And then we can also use that research to formulate new methods, new tools to train academics and to answer new research questions or generate new research questions after we've conducted our research. Now, the idea is that we will disseminate these evidence, and then there will be publications, presentation at conferences, we will conduct workshops. Now we have a social media strategy and we disseminate our findings even through social media. That we do media releases, and if there are patents, we get those patents. But throughout the process, we engage with stakeholders. As you see, stakeholder engagements, even at the research level, at the dissemination level, are all important. Now, we do research uptake because they also have benefits in terms of validation of the research, contextualization of the research, in formulating new research questions in terms of how we see the work progress or grow, and we establish best practices and all that. And then all of these will lead to the impact we really want to see. But also the implementation stage is also a stage where it has a lot of benefit in terms of research informing policies, practice, services for end users. Again, through the process, you can generate new research questions because as you implement, as you formulate a policy, you see that the policy is not working really well. we need to, or the intervention that you put in place is also not working really well. So you develop new questions, you have new program, and you develop new products. All of these will result in the impact we desire. If all of this happen, we'll see more change in terms of social, economic, environmental, and benefits for beneficiaries, as well as change public awareness, beliefs, as well as new research questions. It's also a spectrum. Now, here is also another framework to think about when we are trying to, when we're thinking about evidence-informed decision making. Now, when we want to understand the problem or identify a priority issue, of course, we need evidence to understand the problem, to understand the context for decision, to prioritize the issue, also for problem and causes, as well as stakeholder analysis. This first stage is really, really important for understanding and diagnosing the problem. As you see, at the center, or critical to all of this, is evidence. So it's the evidence funnel, whether it's tertiary, secondary, and primary research, are all key to identify high priority issue. Also, in designing solution, all of these points are evidence, decision-making points. Decision-making points. And all of this can happen. It doesn't need to happen sequentially. It can happen concurrently. But all these stages do occur when it comes to decision-making in our respective countries. So you prioritize the issue, you design solution, and even when you're designing solution, it's important to search, assess, adapt, synthesize, appraise. Well, why all of this is important? Sometimes when we design solution, we are not necessarily designing something that is new and out of this world. We might see a solution that has been implemented somewhere and we just simply want to appraise and adapt. So evidence is also key in designing solution. And that might be a point. And evidence might be it might also be important for program implementers. So it's important that we are able to understand the decision points and see how we can contribute. Now, it's not all the time that we need to be on the table to do all of these, because when you conduct the study and you communicate it, program implementers can actually see the evidence and use it. You can use it to apply for funding, to justify why it's important to address a particular issue, and I can use it to formulate and develop interventions, even with or without our knowledge. And sometimes even your study gets cited in many places. Others actually read your study, they don't even cite it, but they learn from it. Also, when we are designing implementation, or when we are communicating and engaging, when we are doing M&E, evidence is needed, when we are advocating for sustained change or global health and equity, all these are decision points that require evidence. And evidence can really play a critical role in all these stages. I'd say that it's important to note that for us as researchers, achieving policy impacts take time. Do not just simply think that, oh, I've conducted this study and then impart policy in the next year or 2 years, and don't make that promises. Don't make that promise to fund that you're going to do this and it's going to impact policy in the next 2-3 years. The policy making processes might take time. So policy impact might not be something that happens even within the life cycle of your research projects. There are things you can do with your limited resources to achieve impact. I'd say the smart use of social media might also enhance impact of your work. So we should not necessarily say, oh, because I don't have money, I can't do much. We can write our papers and publish in a journal. We can organize virtual webinars that will not even cost us a lot of money other than the data that we will be spending. Also, we need to focus more on knowledge translation as researchers. As I said previously, we need to communicate our evidence in accessible languages. It's important to make connections with policymakers at conferences. Policymakers do attend conferences, or at every other event. that we had the opportunity to meet with policymakers, get their contact, share with them what you're working on, and ask for opportunity to further elaborate on what you do, to make presentations to the parliamentary committee. Do that. As well, gather intelligence and policies that are up for review, because that might be your window of opportunity to inject your evidence. Make yourself known. Make yourself known to policymakers. It's really important that you do this, because if you do not do this, then you will just not be able to substantially impact decision making in your countries. Also, amplify your voice. Start a podcast. Speak to the media. You know, do not just collect your data and keep the reports in a shelf or in a library. Be a champion for the evidence you've generated. I think it's really, really important that you do that. Now, I don't know whether you have any suggestions in terms of how to move evidence, how to move your evidence into policy, or how to do knowledge translation better. Do you have any contribution? We can pause a bit and take a contribution, or you can also share your contribution through the chat box. So I'm going to pause a bit and listen. Okay, if there are no contribution, I'm going to if there are no contributions, I'm going to now move faster. I'm going to move faster now. So, how do we evaluate evidence? Okay, I'm going to skip this because I think we've done this. Now, I think it's also, this matrix here is really good in terms of understanding what studies impact what kind of decision. So I'd said here, if you want to understand the size of a problem, what's the prevalence, what's the incidence, what's the morbidity or mortality rate from a disease or condition, you need a survey, you need a cohort study, you need a quasi-experimental study as well as systematic review to answer the question. If you want to understand the cause of a problem, or why is it a problem, you need a case control study, a cohort study, a randomized control trial, as well as a systematic review. I believe we all understand all these kinds of studies or this study design. This is a framework adapted from the WHO Guide for Evidence-Informed Decision-Making 2021. If you want to, if the questions that is in answering is on effectiveness, does doing this work better than doing that? We need a case control study, a cohort study, a randomized control trial, a quasi-experimental study, or a systematic review to answer that question. If you want to know about process, how does this work? How does this work? We need a qualitative study, a survey, a randomized control trial, or a quasi-experimental study or a systematic review to understand how does this work. If you want to understand value and importance, we need a qualitative study, a survey, as well as a systematic review to understand whether it matters or the importance. If you want to know about safety, will it do more harm than good? We need a qualitative study to listen to lived experiences of beneficiary. We need to do a case control study, a cohort study, a randomized control trial, a quasi-experimental study, as well as a systematic review. If it's about resource use, how much does it cost? We need a survey and a systematic review to understand the cost. If it's about cost effectiveness, are the benefits worth the extra cost? You need a randomized control trial and a systematic review to answer the question. If you want to understand equity, what impact does it have on health equity? You need minimum of a survey down to a systematic review. If it's about acceptability, you need a qualitative study as well as a survey, as well as systematic review to understand accessibility. Is it acceptable to key stakeholders, users, healthcare providers? Now, if it's about feasibility, is it feasible to implement? You need a qualitative survey and a survey, a randomized control trial, experimental study, as well as a systematic review. Now, if it's about appropriateness, is it the right intervention for these people? You need a survey and a qualitative review as well as a systematic review to answer the question. And if it's about satisfaction, you need all levels of evidence to answer that question. So it's important to know the right design to answer a particular question that a decision maker may want. Now let's talk about evidence synthesis, because I've said that it's important to evaluate the evidence that informing decision. And I've said as one thing that's also important that we establish a rapid response mechanism through which we synthesize evidence for decision maker. Or just again to be able to contribute to the decision-making process, we might need to conduct a review to really, drive home our points on why the focus should be on A and not B. So evidence synthesis, what it is, and why do we need to do it in evidence decision-making? So according to the Rural Society, evidence synthesis refers to the process of bringing together information from a range of sources and disciplines to inform debates and decisions on specific issues. They generally include a methodical and comprehensive literature synthesis, focus on a well-formulated research question. It brings together evidence from multiple sources, including published and unpublished sources, to help to comprehensively understand the direction of findings on an issue. And I know that, we've done literature reviews. So I put here, why should we just not depend on a single piece of research to make critical policy decision? And this is a question for you. Let's reflect. Why shouldn't we just depend on one evidence source to make a decision? Why do we need to synthesize evidence? Anyone that wants to answer that question? I can't see the chat box. Is anyone answering the question? Why shouldn't we just depend on one study or one data point to make a decision, to make a policy decision, a critical policy decision?
Hello?
Yeah, please go ahead. Thank you.
I think the major reason is to ensure that you compare what you are thinking with what has been done somewhere else. So the applicability of what you're doing is similar with what was done somewhere. I think it is for comparative reasons.
Great. So Artem spoke about the need for comparative. Lemisa says it is not enough as we need consistency of evidence before we make our policy decision. I think you guys are right on the money. It's important that we not use one study. As we said, science is, scientists are fallible. We don't always get it right. So it is when we look at when we synthesize evidence that we're able to truly tell the direction of effects. So before we conduct our evidence systems, there are things we need to consider. we need to, before deciding to consult on evidence, we need to ask ourselves this critical question. As you know, evidence synthesis is time consuming, right? It's really, really time consuming, and it requires a lot of resources. So it's not something we just want to do. Even it might be important to do it, but we need to ask ourselves this question: can I complete the task given the timeline specified? If the answer is no, maybe not, you don't need to do it. Do I have the time and resources to do this? If the answer is no, maybe you don't need to do it. Are there people who have completed similar tasks previously, or those currently working on one? This is really important because, again, you don't want to duplicate efforts. So you want to conduct a search in Prospero to ensure that there are no ongoing projects that resemble yours. Are there potential collaborators who are experts on the issue, who you can work with to complete the task? I think it's really important. Can I reach out for more support? What type of review should I do? All these questions are important for your consideration before you start an evidence synthesis assignment. I put it even here more succinctly on what you need to do. So if you begin by, do you want to gather all the evidence? So once you've decided to go ahead with the review, you still need to ask yourself more questions. Do you want to gather all the evidence on a particular research topic? And this decision point is to help you. If you want to gather all evidence points, if the answer is no, you might just do a literature review or a narrative review where you just cherry pick evidence and synthesize. And that can also still be fine. You can learn a lot from just a literature review, just like you do for your postgraduate dissertation. You can just do a review of literature. Well, if you really want to gather all available evidence, you need to ask yourself, do I have 3 or more people to work on the review? If the answer is no, more intensive reviews usually require a multi-person team for unbiased article screening. So you might consider to do a literature review instead. If the answer is yes, you need to ask a further question. Do you have 12 to 18 months to complete the review? If the answer is no, you do a rapid review. And there's nothing bad in doing a rapid review. I mean, it means that you won't have to follow all the processes and you just do something and that is possible in that sense. But if the answer is yes, you have 12 to 18 months to spare, you need to ask the question, do you have a broad topic or multiple research questions? If the answer is yes, if the answer is no, you might need to do a different kind of review. You might need to do, if the answer is yes, you do a scoping review because you're answering multiple questions. The focus is really about it. If it is really narrow, you might, if there's a narrow focus, you need to ask for that question. Do you want to review other published systematic review or not on your topic? If the answer is yes, you do an umbrella review. If the answer is no, do you have a well-formulated research question? Yes or no? If the answer is yes, you do systematic review. If the answer is no, just note that systematic review are conducted in an unbiased, reproducible way to provide evidence for practice and policy making, and to identify gaps in research. They require a well-formulated research question. So you might think about formulating a research question. Now, will you use statistical method to objectively evaluate, synthesize, and summarize the results? If the answer is yes, do a meta-analysis. The answer is no, it means a meta-analysis will not be needed. So these are also further decision points to guide you on the kinds of reviews you do, because there are different kinds of reviews to do. How do you then synthesize evidence? It's important, as always, clarify the question that your evidence synthesis is answering a clear or well-defined question, and then you decide on the review method based on the resources and time available. Then you critically evaluate sources, and then you conduct an effective search and extract data You synthesize, map, and present your findings in a succinct and unbiased way, and then you review for quality assurance. We can delve into each of these. So in clarifying the question, to make the questions more succinct, ask yourself, who is the audience of my evidence synthesis? What is the purpose of my evidence synthesis? What is time frame? Ask yourself if you already have some information about the issue. Always ask open-ended questions to elicit more information about the review. And then ask if your question is smart. Is this measurable, specific, and time-bound? Now, it's also important that you evaluate sources, because if you go on Google or everywhere, you see all kinds of evidence. So it's important to evaluate these sources to be sure that they are good enough to be included in your review or in your evidence synthesis. So once all the sources of information for the review have been identified, each source needs to be critically evaluated. Sources can be evaluated by considering the following: who is the authority, organization, or publisher? Is the source credible or authoritative on the particular subject? Think about the accuracy. Is the source generally accurate or well-written? Does it list the author and institution that published the document, including their contact details? Is it objective? Is the source well-referenced? Does it advocate or imply specific points of view? Is it current? Because evidence might be good, but also not current. Now, key points to note. Scientists don't always get it right, so you need to carefully evaluate the studies they're including, and note that there are also a hierarchy of evidence. I think it's important. I'm emphasizing that. Now, if you are doing a much more rigorous review, it might be important that you conduct a systematic search of the literature, where you have major concepts, depending on the type of review, evidence synthesis you are considering. Always, or more often than not, you will conduct a search, and you will develop. You will have a major research plans that will contain keywords that then develop into a Boolean logic for the search. What do I mean by control vocabulary? If you're developing a search term, you more often than not, we need not to use one term, but you look at others that other researchers might use, so that you're able to search for all available papers or studies on the topic. So one example is mental health. Another language that other researchers might use is mHealth, telehealth, eHealth. Or if it's about telemedicine, other researchers might use telepathology, teleradiology, telerehabilitation, all these terms. Or if we talk about teenagers, other researchers might use adolescents, or if you say they might use teen. All these things are, control vocabulary that you might need to search and combine with all. So using control vocabulary to find free tests. So as we said previously, telemedicine might be MLT, health, all these are the terms that are important, but this is how you combine them. So we can move from major concept to keywords and to Boolean terms. So if you're thinking about interventions, people might use programs, projects, initiatives as alternative words. So you combine them with all capitalized. Adolescent mother might be teen mothers, teen moms, young mothers. You combine them with all. So here in this example, we're trying to search for intervention. Yeah, so sorry. I experienced power outage that disrupted the internet. So sorry about that. So I was talking about controlled vocabulary and using Boolean logic to enhance our search. Now, after we've concluded, I think it's important that we screen those articles to ensure that we are choosing the ones that are relevant or the ones that address the sort of questions. And then the next step would then be for us to synthesize the findings, to extract what we think are relevant from those studies, and then to synthesize them. Often when we synthesize those studies, we want to be laser focused on what's important to report. And oftentimes we might be creating tables, figures to further understand maybe the geographical distribution of the studies. We want to understand the methodology they're using. We want to understand what's being implemented in terms of interventions, the approach, all those things we can summarize and present in tables and charts. And also using sort of thematic analysis, which is a qualitative terminology. And then once we've done all that, we want to map and present our findings to answer the questions we initially set to answer. Now, I feel like I need to move faster. Now, when we are synthesizing and presenting our findings, it's important that we present our findings in a simple, clearly, and concise. But it's important to write simply, clearly, and concisely. That we and clear writing means that it is logical, it is direct, it cannot be misunderstood. It uses short sentences, one issue per sentence. That we write short paragraphs, one issue per paragraph. Uses only necessary and familiar words and avoids the use of jargon, which may not be understood by the reader. If it is necessary to use technical words, so it's important to explain them. It's also important that the shorter our review report is, the better it is. Following this best practice, any researcher can write a short, succinct brief. If we avoid repetition, if we leave out, if we leave some important things out, because not all important things should go into our report, we learn to leave some things out, that we use annexes. If there is information that a researcher may want to include, but again, in the spirit of being concise, you think, okay, I can move this to annex, and the people that are in-depth reader might then go and read those. Use quotations only if absolutely necessary. It is better to try and paraphrase rather than copy and paste large sections from other documents, and all quotations, information, and ideas should be clearly referenced. Otherwise, it will be accused of plagiarism. Also, when we are still presenting our findings, it's our review reports. There are 3 critical points to keep in mind. The structure of reports can vary depending on the subject and the type of review you've conducted, and only provide the audience with what they need to know to be informed, to become informed about a specific issue. Don't bombard them with too much information. And then the first paragraph is the most important, as it should always state what the report is about. Now, in terms of structure of your review report, it's important to have a logical and easy to understand structure. It helps the readers to follow the flow of information. Logical structure has the following characteristics. It helps to answer the research questions at the beginning of the reports. First, set out the questions you're answering and answer it directly at the beginning so that the reader does not have to go deeper into the paper before discovering what they are looking for. And then the most important information is found at the start. So we need to learn, and that's why we always present abstract. in our scientific papers, such that people can see everything they need without even going deeper into the paper. So that's the logic structure. Logic structure, be sure to start with your review report, including the headings, have headings and paragraphs with key information to capture readers' attention. It's important to use headings to chunk the information into manageable and easily understood topics. It's also important to use a chronological structure when presenting information so that the readers can see at a glance the key lines of your thinking. So example of a logical structure might be introduction, the Brangang and context, method, findings, conclusion. This is familiar to us as researchers. Now, when you've drafted your report, it's also important to review for quality assurance. Once the research brief has been written or the review report has been written, it's important that it should always be reviewed by either a manager or a senior researcher. Editing helps make a brief clearer, more concise and effective, and ensure that it is neutral. So I'll put a few things for quality checks because we are going to have the slides. So I'm going to skip those. And that's the end of my presentation. We've really taken a lot of time, but I think it's important that we have sufficient time to take questions and answer questions. So over to you, colleagues. Let's discuss. Do you have questions? Please unmute to ask your questions. But if you have comments or contribution, now is the time to take the stage and ask those.
I have a question.
Please go ahead. Thank you.
Okay, so about the translation of evidence to policy, you mentioned that it's the large scale or national evidence that is likely to be translated to policy. But then my question is, because of maybe resource constraints, most studies are small scale or at a subnational level. So, and in some cases, they give evidence of the specific contexts which are special to that particular region. So what are the chances of these small studies being translated to policy? And then my other question is about these politicians, the members of parliament, Ministry of Health, CEOs of organizations. Maybe you can give us examples of who these policymakers are, especially in the mental health space. Thank you.
Thank you very much. I think those are important questions. And I don't have to be the only one to respond to these questions. If you also have some thoughts, you can also sort of reflect on that. Now, I'd said that the most desired form of evidence are evidence that are generalizable and nationally representative. As you know, when you are making decisions for a whole country, you don't want to base that decision on a small scale study, say probably done in an informal settlement. You need something that is representative, nationally representative. But that's not to discourage you, because you might not have resources to do a nationally representative study. So I don't mean to say that to discourage you. As I said, there is a role for citizen science, citizen engagement, and that is also fine. It's not only large-scale surveys or the randomized control trial or the systematic review and meta-analysis that inform decisions. So yeah, even though your study might not be cited as what is helping policymaker to prioritize an issue or to understand the burden of a problem, for instance, your small scale study can still play an important role. Your qualitative study in that informal statement might help policymakers to understand the severity of the problem. So it might just not help us to understand the prevalence or the burden or the distribution across the country, but it might just play an important role in helping policymakers to understand lived experiences, which are also really, really important, as you know. Even expert opinion, even your own thought thinking, because you're an expert on a particular issue, you just going in to meet with us parliamentary committee and to share your knowledge might be important to move the needle, to move the needle on an issue. Even lived experiences, as a person, say that I've undergone a medical procedure, you might have a lot to say in terms of advising policymaker. I do know, and I've been in so many policy space, and I've seen situations where cancer survivors have come to testify about their experience in navigating access to care. Whether the insurance is sufficient, all those things, they've come in to play an important role. And that's just one person's story. Is important. So even smaller scale studies can have an effect. You can come and say, yes, I've been studying this issue in this community, and here is what I found. Again, centering the voices of your research participants in that community. And it might help convince some decision makers. But in terms of what helps to understand the burden of a problem in a country, if you do a nationally representative study, it's more likely that it will be used in understanding the issue than a small scale study. That's just to say more likely to be used, not that yours will not be used at all. I hope that's allays your fear in that, and it means that if you do small scale study, you need to do more in terms of knowledge translation, and that takes me to the second question. Could you repeat the second question again? I sort of lost my chain of thought in terms of what you are really asking in the second question. I know it's about knowledge translation.
Yeah. So who are the policymakers?
In the
Who are these
mental
policymakers?
space are many or decision makers. But in terms of who is making the national policies, often they look to two places or three places. Let me just say two places, even three places, right? There's the judiciary, there's the executive, and then there's the legislation. Now, when we are thinking about the legislation, it begins with your members of parliament, the Parliamentary Committee on Health, and the entire parliamentary forum, because they do two things that are really important. They approve budgets from the executive. So if you want more money allocated for mental health, if you look through the budget, you can go to the parliamentary committees when they are public hearing to say that this budget is good, but you've not put enough money in mental health. That's a decision point that you can contribute to. Now, there are bills before the parliament to establish maybe mental health centers. There are bills in the parliament to criminalize or to decriminalize suicide, for example. There are bills before the parliament to now, there are all kinds of bills before the parliament. I may not be enough in terms of what bill might be before the parliament. That time to get all the bills for them. Your views. Now, one other thing that parliaments also do is they have a role to oversee or to oversee the executive or to provide check and balances to the executive. Now, you can write a petition to the parliament to ask them why there is not enough attention to mental health in your country, to mental health issues in your country. And more often than not, they can compel the executive arm of government to do more, to prioritize mental health more in your country. And you can actually do that. You can actually do a petition to say, why are people suffering from depression, not getting access to care? And that petition, if you table it before the parliamentarians committee can call on the Minister for Health, for example, to pose that same question to him or her, to say, why are you not putting enough attention on mental health in your country? Now, sometimes you may not even do petition. All you might just need to do is, after you finish your research, why not talk to a journalist who reports on health and do an article? If you do an article for that journalist, if it gets streamed on their TV station or put in the newspaper, politicians do read newspapers. And politicians that are interested in health issues, when they read the report of your study, it might compel them to do something. And this has happened to me. So we did a study. We were focusing on mistreatment and abuse of adolescents in clinic. When we completed the study, we wrote a paper which was published in BMJ. After the paper was published, we decided to take it a step further, to write an article to be published in newspaper. When we did that, I think the article was published in Conversation Africa. When we did that, a journalist saw the article and decided to interview us to sort of understand more what our findings are. And the journalist took it upon herself to go into the community, to go and find young people who may have had the kind of experience we reported. And she did a story, which was, she did a story, like a short story on the issue, and it was played on the TV. Now, when members of parliament watched their TV, when they watched the TV and they saw that story, they call on the ministry to say, why are young people not getting quality services in our clinics? And they made them answer that question, because they have the role to provide check and balances to the executive. So they can do that. And now, the entire ministry have to be scrambling to see how they will respond to that query from the ministry. And they will be saying, yeah, these things happen. These are things we are doing to address it. And this is why we are, putting this in our budget to be able to train our staff and all those things. So that's one window. Now, cases get litigated, and it's also an important window to contribute evidence. There are coalition groups that might actually sue the government to say that laws criminalizing, say, suicide, for example, are unconstitutional, and justices will have to interpret the law, and they can declare, acts of parliament unconstitutional, for example. So when cases like that are before the courts, you as a scientist have a role in contributing evidence to help the judges make informed decisions, because often judges they are lawyers, right? That become judges. They are not necessarily experts on health. So you can play a role in helping to advise them in shaping the decisions or the ruling that they will be making. So often you can write an amicus brief when a popular important case is before the justice. So they call it strategic litigation. We use it a lot in sexual and reproductive health, on issues like abortion. I mean, if you've been following the debate also in the US, you see that strategic litigation is something that is used a lot in the US, but not even in the US, even here in Africa. Let me give you one example. So when Magufuli was the president in Tanzania, there was an uproar when he made a pronouncement that pregnant teenagers should not be allowed in school because they might negatively influence others that are not pregnant. And the civil society organization actually sued him. They sued the government to say that such declaration is unconstitutional, because he discriminate against young girls and contravene their right to education. And that was litigated. They did not win, unfortunately, in courts. But they went to a quasi-judicial committee on the rights and welfare of children. Africa, there's an African Charter on rights and welfare of children at the African Union, which is also a quasi-judicial, committee that you can sue. But you can only sue to them when you failed in your country. You've tried all the means, you've appealed in your country, and you couldn't have it resolved, and you're still not satisfied, and you explore that parliamentary committee. But what I'm saying in essence is that all these judicial processes do happen, and they require evidence, scientific evidence, to inform that decision. So that's also another decision point. But you need to really follow the news to know what's being reported on mental health, what's happening, because you need to be in that space to be able to contribute. Now, the last set of policymakers are actually the executive, beginning from the president down to the ministers, who are the political appointees, as well as the technical staffs in the ministries. You need to develop relationship with all of them. Now, the one important thing that's happening in the mental health space is that the ministries now are establishing, within the Ministry of Health, they are establishing departments to focus on mental health. That's the case in Kenya. That's the case in Sierra Leone, where we've worked. And in many of the places I've worked, there have always been departments within the ministry focusing on mental health. You need to know those guys, because those are the people that actually are tasked with developing policies for the country. Maybe at subnational level, I don't know whether they have such departments, but you can also push for that at the subnational levels, at states or county level. But within the ministry, those departments already exist, and you need to reach out to them. I always say that it's important for scientists to be part of the technical working groups within those ministries to advise the ministry on what the policy position should be, to advise the ministry on what the evidence is saying about regarding mental health. Because, as you know, the guys that work in the ministry, of course, there are some of them that are real knowledgeable, even with PhDs, but not all of them who are junior staffs, who do the work, operate at that level. But it's important that you establish close relationship with them. Now, if you know the minister, your job is even easier, because decisions are made at higher level. If you know the permanent secretaries or the cabinet secretaries, the higher you know people, the more you're able to influence things. But the idea is you're not lobbying for a particular position. All your interest is to ensure that evidence is being, is the basis to which we are making decisions. We're not just making decisions based on our religious beliefs or based on our traditional beliefs or our community norms, that we are using evidence when we're making decisions. And the closer you are to decision makers, the better in terms of adoption of evidence. I don't know whether others have something to share in terms of how you understand who decision makers are and in responding to your needs, or if you have additional